Hi, my name is Gwynneth and I am a social prescriber in Rushcliffe PCN. The idea behind social prescribing is to support patients to improve their health and well-being. We always say it's the kind of support that doesn't come in the form of a tablet or a bottle of pills, but what we do provide, it hopefully complements those clinical interventions that have already been made with primary and secondary care. So it's a bit of a holistic approach that really gives patients the confidence to have more control over their health and well-being. They might present to the GP with a medical condition, but in the course of that consultation, other issues come to the fore, and the GP or the practice nurse might start to see how those other factors are impacting their health and well-being, and maybe they haven't got time to explore that with them. So this could be that they are feeling anxious, they might have a low-level mental health condition, they might be feeling lonely or socially isolated. They're perhaps struggling with a change in circumstances, whether they're getting older, whether they're losing independence, or indeed they might be poorly managing the long-term health condition they've got. So as social prescribers, we take the time to explore these different circumstances and factors that are impacting them, and we begin to focus on what really matters to that patient. And we offer one-to-one sessions with these patients over a period of time. It could be a few weeks, a few months, so that we can help those patients and support them in identifying a specific goal, something they want to change that's going to really improve their health and well-being. The goal could be losing weight, it could be taking more exercise, it could be managing their anxiety and having some strategies to kind of fall back onto. It could be information about the benefits that they might be entitled to that might then enable them to access more care and support around the house. This might take the place of a referral to a service or an agency that we know of that will help support them in that weight loss, or a talking therapy. And then other times it might be about connecting people into community groups and helping them to maybe take up new hobbies and feel like they belong. Possibly even volunteer and help to run the group, even better. And then we empower them in helping to reach those goals by helping them to make those changes themselves. We've worked alongside our surgeries in contacting vulnerable patients to make sure that they're safe, they're well, that they've got access to food and medication, and to offer emotional support as well, maybe by referring them into a telephone befriending service. And then more recently we've been extended this to these wellbeing checks by working alongside the Nottinghamshire Community Hub. And this is at the same time as referring, still managing our caseload of referrals and still holding those patients and working with them where that's appropriate and where that's possible. So during the lockdown, it has highlighted the importance of social connections, how communities can come together and do come together to look after each other. It'd be really exciting if we think we can be part of that as social prescribers. We can be part of that community spirit, those community groups that are really wanting to continue to build on what's already there with that community spirit, with volunteers who maybe had never realised that's what they could offer.